This is Dr. Varun, and I am a consultant neonatologist. In neonatal specialty, the most common problem which we deal as a neonatologist is problems related to prematurity. So, in pregnancy, we all expect that the pregnancy will continue till term gestation, which is considered as a layman point of view of 9 months. So, it is equivalent to 37 to around 42 weeks of gestation. So from the time the mother has conceived, and this is counted from the last menstrual period, the first date of the last menstrual period which the mother has had. So from there, the gynecologist counts the week, and it is also correlated with the ultrasonography reports. So if a baby is born below 37 weeks, then we diagnose these babies as born preterm. And if the babies are born much below 34 weeks of gestation, then these babies are, more in terms of risk and requires admission in a neonatal intensive care unit. And because of babies born preterm, their weight is also very less. So if a normal baby weight is 2.5 to around 4 kg, these babies are less than 2.5 kg weight. And the baby's weight can range from 500 grams at 24 weeks of gestation to around 2.5 kg at 37 weeks of gestation. So these are the babies whom we describe as babies who are born preterm or babies who are born too soon. So as I mentioned, when the babies are born preterm, their organs are weak, they have not become mature to deal with the various functions required to sustain life. So the first problem which this baby face is to sustain or start breathing at birth. So the baby, where the baby is born, plays a very, very important role in survival of these babies. So such babies should be delivered in healthcare facilities where optimal treatment and supportive care can be given according to their requirement. So most of all important is delivery room care where the babies are provided breathing support so that they can start their breathing, they can maintain their oxygen level, they can maintain their circulation. And then over the period of journey of their neonatal unit, they can, come across various complications which are related to various organs of the body. So if I talk about lungs, then these babies, as I mentioned, that have difficulty in initiating breathing, but also may require breathing support for few days and weeks. Some of the babies can require mechanical ventilation, which we call as breathing machines. Some of the babies may require surfactant, which is a lubricant which is instilled in babies' airways on day one or day two of life to open their lungs. At the same time, their heart can be a little bit on the weaker side, so their pumping can be lesser. So they need some support to maintain their circulations. They can develop a disease which is called as PDA, which is a patent duct between the right and left side of the heart. So after birth, this is supposed to get closed because this maintains the fetal circulation. It diverts the blood coming from the mother towards the baby's body. So if it is not closed at the right time, they can develop, fluid overload. They can have difficulty in breathing, and also they can affect their circulation to various body parts. At the same time, they have a premature gut, so nutrition becomes a challenge. They have difficulty in digesting mother's milk, so we need to take care of that. Their kidneys are immature, so we need to look at the functions of the kidneys. We have to monitor their electrolyte and fluid levels. Most important, what we are worried as a neonatologist is the brain part, because that is the thing which decide how is baby going to develop in future. So we want to have a better cognition. We want the baby to have a better neurodevelopment, and there comes a very important role in how the baby's brain behave. So first 7 days of life can be challenging for these babies, and the more the preterm the baby is, the higher the chances of bleeding in the brain. And this can impact their outcome. So, as a neonatologist, we are worried about bleeding in the brain, which is called as IVH in terms of medical language. So, we need to look as a holistic approach we need to give as a neonatologist when we are taking care of babies in the NICU. And we need to look at various problems which a baby can develop because of prematurity. So, as I've explained in my previous two questions or previous two answers, that premature babies they do differ from a baby who has been born at proper time, in that they require a little bit of support from neonatal intensive care unit. They are different in terms of weight, but once they have crossed this, duration of what they have lagged, like how early they were born, once they have crossed this duration, then most of the babies do well in comparison to a baby who has been born on time. So we have many babies on follow up who were born between, 500 grams to 1500 grams, and babies who are like 1000 to 1500 grams, they do really well 90% of the time, or comparable to the term babies. And babies who are born between 500 to 1000 grams, now every week, like from 24 weeks to 28 weeks, will change the survival, and will change the outcome. So when we counsel parents of the babies who are born preterm, then the first thing we try to educate them or inform them is that what to expect in terms of survival and the long term outcomes. So suppose a baby who is born at 24 weeks, in our Indian setup, only 30 to 50% of these babies can survive. And babies who survive, in them only 50% chance is that they will be completely normal. 50% chance is there that they might have some deficits. And for these deficit, is not that we don't have any hope. We have long-term neurodevelopmental follow-up. There are super specialists like neurologist, developmental pediatrician, pediatric orthopedician, ophthalmologist, dietitian, pediatrician and neonatologist, speech therapist, who can help these babies to achieve normal outcomes and lead a normal life. So a lot of effort goes into managing babies who are at born at very preterm or extreme preterm, what we call. So with lot of what you call with a lot of or some support, these babies can do well and can do comparable to the babies who are born on time. We have a dictum that prematurity is considered as a nutritional emergency. As I mentioned, that the gut of the baby, the intestine, the stomach, they are premature when the baby is born early. So they are not able to digest enough milk, which is required for optimal nutrition. So the first decision what we make in our neonatal unit is whether this baby will do well completely on mother's milk, or do we need to start a elixir of fluid which is called TPN, which is protein, fats, and carbohydrates given in the right proportion, along with multivitamins and fluids, to sustain the nutrition till the baby is able to digest everything from the tummy. The best nutrition which a baby, even a preterm baby, can get is mother's milk. So the most important support which we need to give is to give it to the family and the mother. We need to counsel them how to start expressing the milk right from day one, and educate the nurses who are looking after the mother to express mother's breast every 3 to 4 hours, so that the milk start increasing and the milk becomes available for the baby. For the baby, we feed the baby via a tube which is inserted from the mouth to the tummy, and this helps in giving the milk, because we know that they will not be able to suck directly from the mother's breast. So we need to give what is called as tube feeding, and this may continue till the baby becomes enough mature to take directly from the mother's breast. So the first thing is focus on the mother's milk, and second, whether the baby needs a special nutrition which is called TPN. Now, for TPN, a baby needs a level 3 care. So, what we advise, or even the government of India advise, is that babies who are less than 1200 gram at birth, or babies who are born below 30 weeks of gestation, they should preferably be delivered in a unit which has a level 3 neonatal intensive care unit. So, there are various neonatal units, level 1, level 2, and level 3, and they are being categorized as per the level of care which they are capable of giving. So if a baby is very small, less than 1000 gram, Then babies will need mechanical ventilation, baby will need nutrition, TPN via special line, and these are being provided in level 3 care. So such babies should be delivered in those units, and if not possible, they should be transferred after birth to level 3 neonatal care. So this is a very important message I would like to give to the pediatrician, to the obstetric colleagues, and even to the family to decide where the baby is best to deliver. The best thing would be that we can decrease the number of preterm deliveries, because prevention is the best cure as it goes. So important is that mother should take care of health of her during pregnancy and even before planning the pregnancy. So one of the common problem is anemia, urinary tract infection, which can be taken care with proper health checkups. So this can help in prevention of prematurity. The other important thing is to have a regular antenatal checkups during pregnancy. So you need to be in follow up of a obstetrician and gynecologist and get your regular sonographies done. Once you are in like 20 weeks of gestation, they start checking your blood pressure. So, preventing or managing pregnancy induced hypertension, PIH, we call, is very, very important in preventing. So, many times mothers develop PIH because of certain reasons, and that affects the baby's growth. And sometimes we need to intervene to, bring the baby out early via C section when the baby growth is compromised much beyond a particular limit. So, in those situations, uh, uh, optimal care can help prevent, or making baby live in the mother's womb for a particular duration so that the baby is near mature and can be managed, appropriately in the neonatal unit. So, most important is to take care of the health of the mother during pregnancy. And this can help in, bringing down the prematurity rates.